191 of your textbook. Out of this chapter, I've looked at the test. There's two questions on your exam that deal with point of care testing. So this complete lecture that I'm fixing to give was going to be pretty short, okay? There's two questions on your test on point of care testing. I picked out what I think is the most important part, and they'll both be in a multiple choice format.
Yes, sir.
Okay?
You said 191 on floor.
Chapter 10. Now I realize, and we'll talk about this, when I go over the review, I realize that we skipped chapter 9, and I realize that we skipped chapter 8. Chapter 8 has to do with immunology. You've already had immunology this summer, okay, antigen antibody reactions. There's no need to go over that chapter, okay, because you've already taken that course. And then chapter 9 is on molecular diagnostics, which you guys will be doing a paper on, all right? So I'll let you guys read that at your own leisure when you make your paper. So we're going to read chapter 10, and this will be the last chapter for all the information for your first exam. Remember, guys, this book has like 35 chapters in it, okay? So in order to get through this book, I can't cover the entire book in one semester. So things that I feel like we need to skip, we've got to skip, or we won't be able to finish it. We will cover this entire book as far as toward the end. All right, somebody tell me, point of care testing, what do you guys think about it? Because you had a little bit of this in the intro to MLP class. What is point of care testing?
Testing to the patient.
Yeah, to the bedside, okay, and it says that in the first paragraph there. It tells you there's a lot of different definitions for point of care testing, but one of it is bedside testing. You also need to know what this stands for. If you ever see the letters POC or POCT, point of care testing, because that's how you'll usually see it in the laboratory. This is one of those mnemonics, okay? So you just have to get used to seeing these letters where you realize what you're talking about. On page 192, first paragraph. Point of care testing is defined as those analytical patient testing activities provided within the institution but performed outside the physical facilities of the clinical laboratory. Point of care testing usually can be directed at one of two ways. The first thing, now this is not going to be in your book, I just want you to visualize this. They use point of care testing, one definition is in-home use. How many of you in here know someone that's a diabetic, type 1 diabetic, or you've ever heard of a type 1 diabetic? They usually have to have something that looks like this at their house, okay? Their insurance even pays for what's called a glucometer. Yeah.
Just to confirm, type 1 diabetes is not contracted as an adult.
No, usually you find out as a juvenile you have that. That's where we'll talk about it, but again, no insulin, okay? Your body's not producing insulin. If it does, you have an autoantibody that's fighting it off, and so usually type 1. If you're not producing any insulin, you have to take insulin, so you have to take the insulin shot. Okay, and again, I know a lot of you know about this, but I'm just telling you, these glucometers, because this is the #1 used point of care test that's done at people's homes, all right? So what it is, it involves a strip. We won't be tested on this, but I just want you guys to visualize. You have to do a finger stick on your patient, or if you're the patient and you're doing it at home, you're doing it on yourself, okay? And then all it requires is one little drop of blood to touch this strip, and it uses an enzymatic reaction. I think it's called either the glucose oxidase or hexokinase method. It's going to go up there and it's going to tell them what your glucose is. That glucose level can tell the patient whether they need to take insulin or not, all right? So it's a big deal. This is the #1 point of care test that's used in people's homes. I want to write that down. Okay, make sure that you circle that word in that first paragraph, bedside testing. Bringing the test to the patient's bedside. Because I just told you about point of care testing is used at home sites, but it's also used at the patient's bedside in hospitals, okay? There are a few certain tests that they have figured out that it's more convenient to do the test at the patient's bedside than to go through everything where you gotta draw a blood sample, you gotta send it down to the laboratory, they gotta spin it in a centrifuge. But they are coming up with different technologies to where they can make these tests very simplistic and they can do it at the patient's bedside. This glucometer, okay, they also have nurses, EMTs, paramedics. It's considered a waived test to where they can have an LPN, that's their job on the floor, is they look at all of these orders and they can do what's called finger stick glucoses at the patient's bedside. As long as they fall within certain parameters, okay, they can utilize that glucose value. Generally, if that glucose is extremely low or is extremely high in what we call critical areas, they have to draw blood anyway, okay? Because that's kind of a reflex test, that if your glucose is at a critical point, they are going to have to draw blood from the arm. Now they have to send it down to the main lab to make sure that result is correct. Because when you get critical, they're fixing to do something and they want to make sure that that result is correct, because you don't want to give insulin to somebody, all right, that doesn't need it. Okay, so it's just a way to reassure that the test is correct. There are advantages and disadvantages to doing point of care testing, okay? Just so I don't forget to tell you, because they're coming up with new technologies, the finger stick glucoses, even though that's just about all you're gonna hear me talk about as far as that's the main one they do, some places are starting to develop technologies to where they're doing other tests at the bedside, okay? Like, I'll give you some examples. You won't be tested on this, but I'm just trying to make it where you can kind of see the whole picture. Another test that they're starting to do at the patient bedside is what's called an occult blood test. All right, that's a real simple test where they can take a little bit of fecal matter, okay, and they can put it on a card and they can add a couple of drops of hydrogen peroxide to it, and when they do, it produces a blue color. Because sometimes if you have blood in your stool that you can't visually see, so occult means that word means hidden blood, all right, and so that's a screening test for colon cancer, basically. Now that doesn't mean if you're positive you got colon cancer. Many people test positive for blood in their stool because they have a hemorrhoid, something that simple, all right? But they will do occult blood sometimes at the patient's bedside as well. You'll know that in the lab because we also do those tests down in the lab where they make these little cards and they tube them to the lab. The stool is already there, and all we do in the lab is add the 2 drops of hydrogen peroxide. But you'll know if they're doing it at the patient's bedside because usually they'll call the lab and they'll say, can you send me up those little hydrogen peroxide bottles? Okay, you'll know they're doing it at the patient's bedside. Another one that some of you may have heard about is, remember this summer when we talked about ProTimes and PTTs? They are starting now, they've got little devices that can do ProTimes at the patient's bedside where they can actually stick the finger and they do a ProTime off of whole blood. That just means the drops of blood coming out of the finger. They can do a ProTime a lot faster than we can in the laboratory. That's another example. So just understand that point of care tests, you know, a lot of places are gonna say, well, that's for in-home use of patients where they don't have to come to the hospital, but they also do it in physicians' offices. They do them at nursing homes, for example. Let's say that you have a nursing home in Mount Ida, Arkansas that's got 25 or 30 people in it. You may have a nurse practitioner that goes by there every day and checks on those patients. Well, that's a lot of work to transport one of those patients to the hospital or a healthcare facility to do lab tests. So a lot of times nursing homes will have point of care tests. Not a barrage of tests, but they may have a machine, for example, called an iStat. That's a machine that kind of rolls around that can do some of your basic common tests, like can do electrolytes, can do maybe hematocrits or things like that. Things that can be done that tell the physician a lot of information, but you don't necessarily want to have to transport them to a hospital for that, okay? So let's talk about some of the advantages and disadvantages. These are talked about on page 192, but that chart basically lists all the advantages and disadvantages. I've highlighted a lot of these that I feel like are, you know, important. I'm in the left-hand column on page 192 under table 10 tax 1. The biggest thing there is it says convenience for both the attending physician, nurse, and the patient. The next one says reduced turnaround time for test results. There can be major decisions made in things like the operating rooms, the emergency department, and intensive care units. If you have a point of care testing program at a hospital, other than the finger stick glucoses, usually those point of care tests are done in critical areas. Again, anything that you just think you need the results stat, and that covers the OR, it covers the emergency room, maybe even possibly the cath lab. That's another place where you want your results really, really quick, okay, to where they'll do the test at the patient's bedside. Oh, skipping down about halfway, it talks about a lot of people feel like a finger stick point of care test is less trauma for the patient as a smaller sample of blood is required. You normally don't do point of care testing off of blood that's drawn from the arm. You normally do it off of finger stick blood. So if they can develop a technology of a little instrument that can give a reading off of finger stick blood or whole blood, hence this little thing right here, okay, then that can become a point of care test. Like cholesterol, for example, they can do a cholesterol test off of blood from the finger, all right? So that'd be another example of that. Another one down there, improved cost of overall patient care, all right? Now again, the key word there is overall patient care. As we're gonna talk about, point of care testing actually is more expensive than sending it down to the lab to have it done. Because most of them have their own little cartridges and things like that. Those tests are quite expensive. When they're saying overall patient care, what they're talking about is if that physician, for example, is concerned about colon cancer, and they can take a little bit of stool and put on their finger, okay, and they can wipe it on a card and tell if there's blood in the stool right there, that can determine maybe that patient getting to go home a day earlier. Then instead of having to collect 3 occult blood cards, send them to the lab, you know, I know our protocol was we had 8 hours to do an occult blood because it doesn't hurt for them to sit in those cards. And so they get the results quicker, therefore the patient can go home quicker. That's what they mean by the overall cost is cheaper. But it's more expensive to do point of care tests as far as each individual packet than it would be to send it to the lab. Okay, over in the right-hand column under disadvantages, the very first one says point of care testing is significantly more expensive than the cost of central lab testing due to the higher disposables and reagent cost of the point of care testing analyzers or kits. Skip one of them, and it says one that I hit on pretty hard is management of point of care testing is challenging. It says there are numerous operators to train, multiple sites to manage, and hundreds of point of care tests to validate. So I'm going to spend a little bit of time talking about that because I just want you to imagine, let's think of a big hospital in Arkansas. Yeah, Tanner?
What was that first one you said?
The first one, the very first one under disadvantages. POCT.
Okay.
Just highlight that one. Okay, so let's just say, for example, let's take the glucometers again. Let's take a big hospital in Arkansas. Let's say St. Vincent's and Little Rock. So they're using glucometers on all of the floors to do their patients' finger stick glucose test. Now think about how many nurses, even though this is a very simplistic test, a lot of this testing, the nurse or the LPN or the CNA or whoever it is that's doing these, they have to be trained on this. Even though it's not real hard to do this, but they still have to be trained, and more than likely there's a sign-off sheet where they have to be signed off. And some of these glucometers, when they go around, you have to scan the patient's barcode, and it will not let you operate that machine unless you scan your barcode also. In other words, it has to identify that worker that they have been trained on that particular glucometer device in order to perform that test, okay? So now think about all the employees in a hospital that work on all these different floors, and they've all gotta be signed off on these glucometers. Think about how many people get hired at a hospital. You've got new employees, all right? So a lot of places, they actually have what's called a point of care testing coordinator. Usually they hire techs to do this, all right? I know one at St. Joe, or CHI in Hot Springs, that, they are a medical technologist. They don't even really work in the lab. All their job responsibilities is to go out and train the whole hospital on how to do all of their point of care tests that they do. It's a good job. It usually pays really, really good. We took the students one year to St. Vincent's. It was like 2 years ago. And I was met at the door as we were bringing the students in, and they asked me, they said, "Britt, do you know anyone that would be willing to be our point of care testing coordinator?" Okay? They said, "We can't find anybody that's willing to do it," and they said it pays through the roof. But it's kind of a stressful job because, again,
You gotta stay on top
you have
of
to
it.
make sure everybody's trained on not just these glucometers, on iStat machines, on anything that involves point of care testing. You have to be the one that keeps up with all the documentation, but they do usually hire a med tech to do it. And I'm not even saying that they couldn't hire an MLT to do it, okay? That's another, from time to time, you're gonna hear me tell you guys, there are ways to not just work in the laboratory with the degree you guys are gonna get, okay? Now, it's not like registered nursing where you can go to so many different fields. More than likely, the majority of you are gonna work in a lab somewhere. But if you get in a lab and you hit that burnout stage that I hit after about year 10, there are different paths you can go into where you don't necessarily just have to be a tech working in a lab every day.
I
And
have
this
to
is
come back
one
and
of
do
them.
this.
That point of care testing coordinator. Okay, going on down in that same column, there's another one that says difficulties. Again, I'm talking about disadvantages with care testing. Another one says difficulties with documentation of test results, billing, that's the main one, billing, and regulatory compliance. One reason that you don't see as much point of care testing as we do is simply because it's hard to bill for it, okay? When you're working in a laboratory, you may not even realize it as a tech, but every time you're on that computer and you a test result that let's say you're doing a hematocrit or a CBC, every time you hit enter and validate that, that trips a system where that patient or the insurance company gets billed for a CBC, right? Every time you result, it doesn't matter what you result, it goes through a process where that patient is getting billed for all those tests that are done. But that doctor that I keep telling you about that does that occult blood at the patient's bedside, how does the patient get billed for that test? I mean, see what I'm saying? The doctor does it right there at the bedside. Do you think that doctor is gonna go out to the unit secretary and say, "Hey, by the way, I just did an occult blood on John Doe over there. You need to put that in the system." So that's one thing that they have trouble with point of care testing is there's not a way to bill the patient for it.
I thought coders handled that as far as like coding what was done and then sending it off for
If the
billing.
doctor relays that information.
Yeah, if it's in like the nurse's notes or something.
Yeah, if it's in the nurse's note, but it's all about the billing process. Now,
At
you're-
National Park, whenever they stick you glucometer, it prints off a sticker. and
Well,
all
my
that,
mom was a
and
coder, that's
there's
the one
a-
reason I
There
asked.
was a glucometer, so, and if they do a cut blood in the ER, they have to send us a yellow piece of paper and put an order in the computer, cause if they don't, then they won't get billed like you said.
Well,
Seems like they need
glucometers, the
home
one that I'm showing you guys, this is a glucometer for home use. Usually the ones that are at the hospitals that they're doing glucoses on the floor, they have like a little box they come with, and believe it or not, their glucometers are actually interfaced with the hospital's computer system. So they do get billed for the glucoses. I'm talking about those point of care testing that like the occult blood and things like that, where they don't have an electronic device where it gets downloaded into the hospital system. And hospitals get a little upset if they find out they're doing tests for free, okay, and it happens.
If the nurse don't write it down and the coder don't
Code it up.
then nobody's getting.
Well, that's what I mean, and that's how come we had a policy, remember I was telling you about the floor would call down to the lab, and if I'm working in your analysis, they'd say, "Hey, Britt, will you send me up them hydrogen peroxide bottles that you guys keep down there to do the occult bloods with?" They told us to never do that, because they said, when you send them that bottle, They're doing that occult blood at the patient's bedside so they can tell the physician real quick, like, they're positive for blood in the stool, and they're not getting charged for it. Because what do they do with that occult blood carton? They throw it in the trash, okay? And that test was kind of a freebie.
So you're sitting in the lab, you're gonna take the bottle, you're gonna send it up the blood tube or whatever. In the back of your mind, you're thinking, this hospital's about to lose money just on the hydrogen peroxide itself.
Well, it's just that.
Forget the test that it's about to be involved in. That bottle itself costs the hospital some money too, and it's going away,
And you're probably not gonna get it back.
Right.
That's another thing. When you tube that bottle of hydrogen peroxide that comes with that kit up
They
at
throw the
4
whole
East or
thing
whatever
out.
floor, whatever nurse is asking for it, now you're gonna spend the next 30 minutes after that thing's over, like, where's my bottle at? And technically, if that bottle leaves the laboratory, that means
You
that
can't use it.
you're not really supposed to use it, because you don't know what you don't know, even though it's hydrogen peroxide, you don't know what that was, what kind of environment it was. They could have had it in a microwave oven for all you know, and now they send it back to the lab, and you're doing patient tests on it, and it's not working. But luckily, we run controls in the lab, right? So we'll know if that occult blood's working. With every occult blood card, there's a little control that you add one drop to these two little windows, and those windows, one's positive for blood and one's negative for blood. Okay? So again, I'm not trying to make point of care testing confusing to you guys. I want to make it interesting to where we're just talking about it, but it's all about doing testing at home or at the patient's bedside in a hospital, okay? But there are certain places where point of care testing has a lot of advantages. Again, nursing homes, things like that. Even health fairs. Have you guys ever heard of what a health fair is?
Yes.
A health fair, for example, is where, okay, out at the mall, they say, hey, we're gonna do free, heart attack screenings or free cardiac screenings. And they're gonna have a little handheld device, because they make some, that will do, for example, a cholesterol and a triglyceride level. And all they do is take one drop of blood and they put it on a little strip. They're very expensive, okay, and they can tell you what your cholesterol is and what your triglycerides are. And usually you mail that back to the patient and there'll be a note with it that says, your cholesterol appears high, you might wanna go to your attending physician, okay? So it's all about getting you, they say they're doing it for free, and I'm not saying that they're not, but at the same point, they sure give you a number to call if your result's abnormal, and that gets you going to a physician, right, which generates money, so.
So I bet they do a lot of point of care testing at like psych wards.
Hey, Dr. Burke.
Hi.
What's
I
up?
would imagine.
We're talking about point of care testing.
Yeah, it's cool, still gotta calibrate everything, still gotta run controls.
Yeah, we hadn't talked about that part yet.
Yeah, I mean, it's, I think the local hospitals, respiratory does I think there's point of care testing for blood gases.
Yeah.
It's not at saline, they don't use point of care testing at saline, but you still have to have controls, you still gotta calibrate them.
Yeah, we're talking about the disadvantages right now to it, about like, why don't they just do more and more of them? We're talking about how billing and all of that. kind of
It's
stuff.
got the communications into the medical record is complicated.
Yep.
Session numbers, so he's telling you, and all that's gotta get linked in the medical records, and then you've got all those privacy issues
Oh, yeah.
that have to be talked about. Now, what we do have, they finally got, used to be, it was real, even to say, I work at Saline, I draw blood gases all the time, but you would have to run it on the on a blood gas analyzer, similar to what you have in your lab. Then you'd have to, it would connect to a computer, then you'd have to log onto the computer, so you ran the blood gas, log into the computer, get the blood gas, assign it to an accession number that would load it up into the medical record. So all of that is done. All that still has to occur with point of care testing. So it's not just easy. A salesman walks into you and says, oh, hey, look, you just do this, something there, act like you're, no, it's not. There's a lot of other I's that gotta get dotted and T's crossed. So I was looking for it. What happened with the baseball thing?
What's that?
What happened with the baseball thing? Wasn't that yesterday?
Baseball? No, I don't think, we didn't do anything yesterday.
I thought the voting was yesterday.
Oh, it passed.
Oh,
Oh,
okay.
I didn't, I thought you meant play.
His son plays baseball
Yeah.
a lot, so.
Yeah, it passed, so they're gonna be building that, basically.
Alright,
It happens.
now they care about blood gases, respiratory, stuff like that, go ahead, Matt.
Thank you.
That's fine.
Okay, so, again, getting back to the point of care testing, in my opinion, another disadvantage to it is simply anybody can do it. Point of care testing is considered waived. Remember all those kits you did this summer, and you probably were sitting there saying, this really ain't that hard. I'm just adding one drop of urine looking for a plus sign, right? So point of care testing is considered waived testing. Because of that, one thing that I don't like about it is, you know, other people other than lab techs can do it, okay? They can have an EMT, a paramedic, they can have an LPN, RN, the doctor theirself, like I was telling you about the occult blood, anyone can do it, okay? Whenever you have that many people that are involved in being able to do lab testing, sometimes you have problems that occur. Because, like Dr. Burke was saying, they don't know about the importance of running controls. Even though you're doing something as simple as an occult blood test, we're gonna do an occult blood in the urinalysis test, okay, or in the urinalysis class. I'll make up stool specimens and we're gonna do them. But you, by the time you finish this program, you're gonna, in your head, whenever you're doing a test, you're gonna think, how do I validate the fact that this thing is working? Like, Stephanie's occult blood is positive because it's truly positive. It's not an abnormal result because this thing's 6 years old and every time you add a drop of anything, it's coming up positive. That's the only thing that me personally, I don't like the fact about all the different healthcare professions being able to do point of care testing is they don't understand quality control the way you guys probably are already starting to realize how important quality control is. Because even if, it doesn't matter what test you do, even a finger stick glucose, you have to run controls even for those. And I have talked to so many people before that do these at home, every day. And I'm like, how do you know you're getting the right result? And they have no idea about what controls are. But they don't run them the way they should. What I'm
Oh,
saying
well, that's
is,
them, no, I stick myself and I run them, so,
Yeah.
that's them. They
but
don't
you
do it.
know, Wendy, you
Yeah.
got a background.
No, but I mean, it comes in your box whenever they send you strips
They
to
don't
people.
read
that-
that.
Yeah, I was gonna say, there are
Yeah.
people that'll just look at that and be like, I don't know what these are. I mean, my mom never reads directions for anything and then asks me, how am I supposed to use this? Did
And
you
what
read
if
the
they-
directions?
What if they do know to run the controls and they're not getting the right results, but you know what I mean? What are they gonna do? They still gotta do the test. They don't realize that if the controls don't work, you need to calibrate it. You can calibrate that instrument where your controls will start working, okay? So anyway, that's how I feel about it. I think that they're good, but I think hospitals lose a lot of money on it because everything's not getting billed at the same time. As far as accreditation on page 193, there's something I want to talk to you guys about. I'm on page 193 in the left-hand column, halfway down under accreditation. It says in the United States, lab testing for patient care, with limited exceptions, requires what they call a CLIA certificate. Okay, so what that means is that for all of you in there that are thinking, the heck, we're going to work in a hospital, I'm gonna run tests out of my house, okay? Like I'm gonna do pregnancy tests for $2 a piece, or I'm gonna do Coggins testing on horses. Actually, you might be able to get away with that one. But they won't let you, because I used to think about that all the time, like, why don't I go in business for myself? You know what I mean? Buy me a little analyzer, do cholesterol screenings for people and charge half of what these clinics do. Okay, they get you because you gotta have a CLIA certificate. And to get that CLIA certificate, you gotta fall under certain guidelines where most healthcare institutions are gonna be the only ones that can do it. So I'm gonna tell you guys a little story that we used to do out here, and we stopped doing it for this very reason. We used to do for the college, many years ago, we would do cholesterol screens for the students. We had one of those little instruments that would do cholesterol readings off of whole blood back in the J. Wilburn days. So we would have a big thing, a health fair, to where we would, do these tests for all the students, and we would tell them like your test is abnormal, or you know what I mean, like it's greater than 200. Technically, if we don't have a CLIA certificate, we can't do those tests for students, even if they're free. You can't do a test on someone and validate that and actually say, okay, this is official. We did a cholesterol screen, and your result was 320, it's abnormally high, you need to go see your physician. You're breaking every rule in the book when you do that. We used to go to all the Head Start programs. Matter of fact, there's a picture of one on this wall behind me. And we used to do hematocrits on all the young little 5 and 6 year olds. We would take our own centrifuges and plug them up, and we would take blood and capillary tubes, and we'd spin them in those centrifuges, and we would have on a sheet of paper what all of the results was for all that. But if we don't have a CLIA certificate, technically we can't do that, okay? Because you can't just do lab tests. Anyone just can't do lab tests because you're in the MLT program. So we stopped doing that, okay? Now, I was told earlier back that Jay Wilburn did technically have a CLIA certificate, but we stopped doing that because you can get in trouble for that. How many of you in here, some of you may have come to me and like, hey, do you care if I do a mono spot on myself or whatever? What's the first thing I tell you guys when y'all say that? I know
No.
some of y'all have asked me. No, I'll let you. I mean, if you want to do a pregnancy test on a kit we have in there, whatever, but I will not stand behind it. In other words, if you say you did a mono spot on that kit in there that's from 1995, I'm not standing behind it. I'm not. If you say it's positive, I'm not telling you, well, okay, then go to your doctor and tell them you got the Epstein-Barr virus. You know, I'm not standing behind any test you do in that laboratory. I'm just saying, I'm putting my tail on the line if we were to do that. Okay, you following me on that? So anyway, you have to have a CLIA certificate. If you don't have a CLIA certificate, that means that you can't get paid any money from like Medicare, Medicaid, any of those, and they will not pay a laboratory that does not have a CLIA certificate. If your lab does something wrong, I've worked in one of these labs too. If you do something that gets you in bad enough trouble, or let's say your lab fails enough proficiency test, or let's say they get caught cheating on a proficiency test, the first thing they do is they pull your CLIA certificate. If they pull your CLIA certificate, your lab basically is shut down because you can't get any compensation for Medicare or Medicaid, all right? So people are real happy when they get their CLIA certificate number. When you guys start working in the field and everybody's communicating on Facebook and stuff, you'll see like labs where they post a picture and say, hey, we passed our JACO inspection and we get to attain and we get to keep our CLIA certificate number. Okay, that certificate number is what allows you to get paid from insurance. Point of care testing complexity. I just want to go over a few things with you guys, that there's different types of complexity of tests. There's something called waived that are very easy tests. Okay, and then there's something called moderate complexity, high complexity, and they've even got one that is called PPMP, Provider Performed Microscopy Procedures. Every lab does certain tests, and every test that you do falls under one of these categories. If you're doing a test in blood bank, for example, like we've been doing blood types, what complexity do you think that is? Where we're doing blood types in there, where you're adding 1 drop of cell suspension and 1 drop of reagent, spin it in a centrifuge, look for
Moderately or lower?
It's actually high.
Oh,
Is it?
High complexity.
I guess
Yep,
it's what it is.
because you're having to do an interpretation.
Okay.
From your knowledge that you've gained through this program or whatever, you are having to interpret things. There's not a machine doing it for you. Actually, machines, for the most part, make the complexity go down.
Okay.
If a machine does the test, that's not requiring as much in-depth knowledge, okay? So, again, this is just for your interest. This will not be on the test, but I'm wanting to just explain to you departments where it's considered high complexity test. If it's open for interpretation, which departments in the lab do you think fall under high complexity? Blood bank?
Micro.
Why would it not be chemistry, Aaron?
There's a
Why
lot of
would chemistry not really be a high complexity testing area?
machines.
Because everything's automated.
Yeah.
Okay, machines are doing it. You don't hardly have to interpret nothing. You put the tube on the machine, it go. You know what I mean?
Okay.
It's got all kinds, but departments that are still open for interpretation, like what have you guys been doing in microbiology? You've been doing gram stains, right? Do you think anybody can do those? Because look what all you have to do right. you have to add those stains, okay? You're doing a manual stain where you have to add it 1 minute, 1 minute, 1 minute, your decolorizer is 3 to 5 seconds, right? But that takes skill, that takes knowledge, and it takes, plus after you get finished, you gotta put it on a microscope and read it. That is high complexity every time. That is a high complexity test because not anyone can do that. Some of you can't do it yet because you have trouble focusing the microscope, right? It just takes a little while before you get good at it. You have to be trained properly. So microbiology and blood bank, you can rest assured you are not gonna have a lab assistant working in those areas. They're not allowed to because it's high complexity testing. But certain tests that aren't considered high complexity testing are like these finger stick glucoses. That's a weighed test. But you can't have an LPN working in blood bank doing blood types, all right? You'll have to have a tech that's been through an accredited school and more than likely passed their certification exam in most states. Now, in your reading, it tells you about, how you can go on a certain website and find out what all tests are considered weighed tests, what tests are considered moderate complexity versus high complexity testing. I do want to talk about one category. I'm on page 193 in the right-hand column, halfway down. It says the fourth category of point-of-care testing is called provider-performed microscopy procedures, or PPMPs, which is a subcategory of moderate complexity testing. Now, the reason I want to talk about that is that actually happened to this program, the Children's Clinic over there that's located by CHI on the other side of Hickton Ferry. You guys know where I'm talking about? They used to, every year, they would hire 2 of our students. They would hire 2 of our students to work weekends in their laboratory before they graduated because they did weighed testing. In other words, on those kids, they did things like a strep kit that's considered weighed. They did things like dipping urines because that's weighed. All the tests they did were weighed tests. So our students, when they were in the fall semester, before they had ever even went to clinicals, okay, they would work in that laboratory, but they only did weighed tests. Okay, it was a good way to get their foot in the door. But those clinicals, or that site, they fell under this category because what do you have to do to a urinalysis after you dip it, okay, and you do the chemical exam? What do you have to do next? You have to look at it underneath the microscope. Guess what our student was not allowed to do?
Look at it under a microscope.
Look at it underneath the microscope, because until you get this degree finished, you are technically not allowed to do interpretations underneath the microscope. So they fall under this category because they give certain personnel a deemed status to look under the microscope. And guess who it is? The physician. So when our students are working at that clinic, they would do all of those weighed tests, the monos, the streps, the flus, all those are weighed now. They make them so simple. But if they ever dipped a urine, they would have to prepare the slide and put it underneath the microscope, and they would have to call that pediatrician to come in there and look at the microscope. The students aren't allowed to do that because once you're looking underneath the microscope, you're falling under moderate to high complexity testing, okay? So the students never could do a microscope, but they didn't have to pay the students that much money because they weren't graduated yet, so that it was beneficial to them to run their lab that way. Especially with it being on a weekend. We had a lot of students that got jobs because of that. They worked at the Children's Clinic as a student, and some of them, I think there's been 2 or 3 students that have worked there full time that graduated from our program. Then they could do the microscope. All right, do you guys have any questions on point of care testing? So what I would want you to know is definitely what I wrote on the board, know the abbreviation for it. Basically know a little bit about what it is, okay? It's bringing the test to the patient. Do know that there are guidelines. They still have to run controls. If you see on the test what is the number 1 point of care test that's done in patients' homes? Glucose is right. But there are a lot of other point of care tests that can be done too, but by far the glucometer outweighs all other point of care testing, okay? I'd be able to maybe list 3 advantages and 3 disadvantages. Although you already answered that question in the intro to MLT, that's a test question. I don't know if you guys remember it, but that was a test question. Okay, let's meet back in here at 9 o'clock, and I will go over the review for your first.